A study just released from the American Society of Clinical Oncology found about 70% of women diagnosed with early-stage breast cancer may not need chemotherapy. Here's why. Researchers in this study reviewed the results of a very reliable genetic test. It assesses the recurrence risk. They found that the group in the middle, not low, not high, did not likely benefit from chemotherapy. Hormone therapy could be just as effective. Now, this was based on a scoring system which can now be assigned to breast cancer tumors. I talked to Dr. James Maher at the TriHealth Cancer Institute today and asked about the scoring system as well as that hormone therapy. He said, here's what women need to know about getting chemotherapy.
We used to give it based on the size of the tumor and if it was bigger, and then we realized it's not just how big it is or lymph node involvement, but it's also how aggressive it is. And so this is looking at that aggressiveness. So they took 21 genes, translated that into a number, a score number, and the lower numbers meant that they didn't have to have the chemo. The higher numbers did, and so there was this intermediate group of people that we didn't really know about. So 65 to 75% of all breast cancer patients feed on estrogen. So that's the female hormone, and if we block that female hormone, it's just as effective in those women with lower numbers on that score as having any chemotherapy.
Chemotherapy, of course, are drugs that can kill cancer but cause a lot of side effects. Hormone therapy has fewer side effects, and if it's just as effective, would generally be less harsh on the body. So, of course, the critical thing is that you got to find the cancer early.
Yeah.
And if you know you are maybe less likely to have to need chemo, there's something a little more, okay, I do want to know this because maybe there's something you can do besides that. I think chemo scares a lot of us. You know, I'm going to lose my hair. And without meaning to, you put it off, sort of thinking ahead that way.
No, it's not logical, but we do that as humans.
No, we do. And so I'm hoping that this is one more barrier we break down to say, even if we discover this, you may not need that harsh treatment. You could have it a lot, I guess, kinder and gentler if you want to look at that.